If I traded it all, if I gave
Welcome back, everyone. My next guest is Dr. Bonacci. He's never been on my show before. Doctor, tell us a little bit about yourself and what you do.
Well, I'm a chiropractor, and I have an office in North Scottsdale called Arizona Pain and Posture. And the majority of what we treat is severe, chronic, and complicated pain and injury. And we provide a multidisciplinary approach, as well as incorporate regenerative medicines into our treatment plans. I have a certification in physical medicine modalities and therapeutic procedures in addition to my Doctor of Chiropractic license.
Now, a lot of you, like a lot of us out there, and me and everyone that I know practically, there's a lot of people out there that are dealing with chronic pain.
Yes, there's a phenomenal amount of people. In fact, chronic pain is a $650 billion pain industry that affects more than 40% of adults, more than cancer, heart disease, and diabetes combined. So there is a large population of people suffering out there, and in my experience, we're able to help those people.
So let's talk a little bit about, define then what you call chronic pain, because I know, for me, what I feel like what it means.
Chronic pain is defined as pain that you've had for more than 3 months, very simply. Additionally, the science behind chronic pain is different than acute pain. Chronic pain travels slower than acute pain does. It's more of a relentless stimulus than acute pain. And chronic pain, it doesn't respond to a lot of traditional therapies. It doesn't respond to traditional chiropractic or traditional physical therapy, and in a lot of cases, traditional medicine. It really takes a perfect storm to get yourself into that chronic pain, which hopefully we'll be able to talk about. And it also takes a perfect storm to get you out of that chronic pain.
Now, we've got our lines open here for everybody because you're going to do something special. First of all, I want to get some information there. I had a little something go behind me when I first started. So it is Arizona Pain and Posture.
Yes.
And the website is Arizona Pain and Posture, and is all spelled out, andposture.com. You're located in North Scottsdale at Scottsdale Road in Deer Valley. You always do free consultations, but today you are entering everyone in to win. It's a free comprehensive pain assessment and treatment, and it's valued at $225. And this is for you or anyone that you know out there that is, because a lot of us might have somebody that we know. We all know somebody who's in chronic pain in some way or another. You're rated with the Better Business Bureau. Our lines are open here. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. Now, treatments. When you talk about treatments, because you're giving away this comprehensive assessment that comes along with treatment, what types of treatments then do you offer?
The types of treatment that we offer, first, and if you do go to the website, you'll be able to read more about the techniques that we practice. Over the last 20 years, I've developed my own manual therapy technique that aligns nerves, soft tissues, and joints. So if you think of what a chiropractor does, is he aligns the joint, but the joint is governed by the soft tissue, and the soft tissue supportive structures are governed by the nerve. So if the nerve isn't freed up and the soft tissue isn't freed up, then the adjustment doesn't last long and you get limited outcome results from that adjustment. So my technique is designed to align all three of those, which relieves the pain and improves the motion, as well as we give you stretches and exercises to go home that are also designed to align the nerves and soft tissues and joints on your own. And we also educate on how to sit and rest properly. So again, we're trying to create that perfect storm so you can get out of pain.
Now again, that website is Arizona Pain, and it's all spelled out, ArizonaPainAndPosture.com. They do free consultations, but we've got our lines open here, and everyone is getting entered in to win a free comprehensive pain assessment, but also the treatment as well. So assessment treatment plan, it is $225 value, free to you or anyone you know, rated with the Better Business Bureau. And our number here, 602-277-5369. And toll free, it's 1-866-536-1100. So basically, what do you see mostly when you're dealing on a daily basis in your office?
First, before I answer that, I want to go back and also say that we do have a physical therapist in our clinic, and she practices a technique called Feldenkrais, which she's the only physical therapist in Arizona licensed in this technique. And Feldenkrais it has a manual component to it, as well as it's a slow motion technique, and they use a phrase called awareness through motion, where you learn the exercises and motion is broken down into specific detail, so you're able to understand how that motion is causing you pain, and it allows you to become aware of your pain, so you're able to resolve it more easily.
Now, this is called Feldenkrais.
Yes, Feldenkrais.
And she's the only one in Arizona that does this in your office?
She's who is a licensed physical therapist. I believe there are maybe 10 or 12 other practitioners who practice Feldenkrais, but they're not licensed physical therapists. So when you come to us, you can use your insurance and get Feldenkrais practice covered by your insurance.
Done to you, and they're done
they're covered by your insurance.
So again, that's ArizonaPainAndPosture.com. And again, we've got our lines open here. Everyone is getting entered into win. It is a free, comprehensive pain assessment and the treatment plan as well, and that is a $225 value free to you. So our number here is 602-277-5369, and toll free, it's 1-866-536-1100. When you are, and I got to go on to this, okay? So with this Feldenkrais, is it anybody that would have any type of pain, or is it a certain person that does get this, or does everybody?
Everybody gets it.
Okay.
And it helps with, when you're in pain, it helps you part of it is you need to take the bull by the horns and have a positive effect on your pain at home. And this is one of the best, safest ways to do that.
So when you're in your office, so what is the most chronic pain that you get that they tell you that they have? Where's it coming from?
Usually back pain, usually low back or neck pain. And we get
sciatic pain,
upper back and neck and arm pain. We see everything from restless leg syndrome to headaches to pain that's the result of an old injury or a result of slow degeneration and postural deformation that's happened over time. And that's Arizona Pain and Posture is very descriptive of what we do. We treat your pain by improving your posture and improving your motion, and it's very, very effective.
Now, how do you help somebody if they do have this restless, everybody thinks that the restless leg syndrome, they think that it's their veins, but you can actually help them with their...
Correct.
How do you do that?
You know, it's interesting because we had a patient in just yesterday, and the patient has been suffering from chronic pain for over a year. She's been on medications for over a year, and in just 2 visits, we were able to decompress. Again, it goes back to the technique both techniques that we use in our clinic. And in 2 visits, after aligning the nerves in her low back, the soft tissue, and the joints in her low back, she was 100% relieved of her restless legs. And
the only one in the office who's a licensed practitioner to be able to do the Feldenkrais, I called it that. I don't remember what, I didn't write it down. But they're the only ones that have that. And what a wonderful thing that you offer for everybody, because there are so many people out there that are in pain, and they are reaching out to find somebody that can help them.
Right. In fact, one of the first things that we do with patients, I do quite a few talks at assisted living homes, and one of the first things that we do is we let people know that as long as you're alive, your cells are healing and your body is able to regenerate and heal. And if it's given the right atmosphere internally through diet, exercise, nutrition, as well as externally, your environment, how you sleep, stand, and your ergonomics, you can change that atmosphere and create a perfect storm to heal heal and resolve your chronic pain.
Now, we've got our lines open here. We're going to go to a break, and when we come back, I want to talk further with you. Again, everyone's getting entered in to win a free comprehensive pain assessment and treatment plan, and that is a $225 value free to you. They are read with the Better Business Bureau, and our number here is 602-277-5369. Toll free, it's 1-866-536-1100. It's Arizona Pain and Posture.com. We'll be back in just a minute.
If I traded it all, if I gave
Welcome back, everyone. We are now on the Lair Live with you, with everybody. And Dr. Bonacci, he is the owner of Arizona Pain and Posture. And we have been talking a little bit about, chronic pain. And so many people are in it. I mean, really, I don't know anyone that hasn't felt that in their lives. And a lot of our listeners are older, and so there are a lot of us that are a lot of us in pain. I'm one of them, too. What you see daily, you said, there's sort of sometimes that you see in your office, and we've been talking a little bit about that. Go ahead.
Well, the majority of my patients are referred to me by another medical doctor. And what we see is they've failed to respond optimally to multiple chiropractic attempts, multiple physical therapy attempts, and multiple medical attempts. And they are told that they need to be on medication for the rest of their life, or they're told that they need to have a surgery done, and they don't want to be on medication for the rest of their lives, and they don't want to have a surgery done. So they find out about me, and they come in, and we start to, number one, we repaint the picture as to how they got into chronic pain, whether that starts with an injury or a slow deformation of posture. We paint a picture so they know how they got there, and then we paint a picture as to how we're going to get you out of trouble. And it's a process, and it's an understanding, and you need to be involved with the process and with the understanding. You may even have to change your mindset. You may have to change your mindset to not just treat symptoms, but to treat the whole entire body. We live in a very medical society that mostly treats with medical care. But with alternative care, you can get further results and better outcome. One of the biggest differences with treatments is there's two treatments for chronic pain. One is allopathic, which is mostly designed to decrease inflammation and decrease pain signals to your brain. Then there's alternative therapies, which are more so designed to promote healing and promote cellular division and regrowth in your body, so your body can actually heal and resolve the problem that way instead of just removing the symptoms.
Well, we've got our lines open here, and we've got everybody who's getting entered in to win a free comprehensive pain assessment from them, and it's a treatment plan as well. That is a $225 value free to you all out there. And you're rated with the Better Business Bureau. You're located in North Scottsdale. You always do free consultations, but this is something special. It includes a treatment. So tell everybody again, for anybody that didn't hear it before, what comes along with this comprehensive pain assessment and what you do.
With the comprehensive pain assessment, first we have our own assessment program that we use in addition to a traditional medical evaluation and a traditional medical exam, and that has been devised over a 20-year process. When someone's in chronic pain, it's difficult to tell what the source is, whether it's soft tissue, nerve, or joint. In fact, usually all three are involved once you're in chronic pain. So we use our assessment to determine which one is more the factor in that, whether it's the nerve, soft tissue, or joint. So you'll experience something different than you've experienced at your traditional medical doctor or traditional chiropractic office. And it will shed some light on what is the source of that pain, which then gives you the ability to go home and manage it differently. Also, we will very lightly, our technique is extremely gentle. When someone's in chronic pain, you cannot and you should not be increasing that pain cycle. So the majority of tests that doctors use to determine what is the cause is designed to reproduce pain. Our techniques and our assessment is designed to show relief of pain and improvement. Once we're able to do that, then it's just a matter of getting it to last. And that's one of the things that we try to avoid. Three major complaints that I hear from patients with physical therapy or chiropractic. One, worked but didn't last, or it didn't do anything at all, or it actually made me worse. Those are the three complaints that we avoid, and most importantly, it's getting the results to last. Now, we have the Bonacci method of regenerative alignment, which aligns the parts of the body. We also use the Feldenkrais technique with our physical therapist, but I also regenerative medicine, which most people are familiar with stem cells, but there are also two other treatments out there called prolotherapy and platelet-rich plasma. Prolotherapy is short for proliferation, meaning it allows the cells to proliferate. And in few, maybe 10 or 20% of my cases that we can't get 100% relief, we co-manage those patients with other doctors to inject certain areas to allow for more stabilized joint structures, more increased structural integrity, so they get longer lasting relief from the adjustment, and it holds, and then they can minimize their pain medication and look more towards alternative therapies and get their results.
Now, again, that website is ArizonaPainAndPosture.com, and we can call in here, and everyone's getting entered in to win this comprehensive pain assessment. Comes along with the treatment. Again, that phone number here is 602-277-5369, and toll free it's 1-866-536-1100. And basically, when you talk about that, that's the downward spiral that they are. They are coming in and they're telling you, I am not getting any relief from anywhere that I've been.
Yes, correct. And oftentimes they will run the gamut of chronic pain. As we were talking about, it travels slower. It's a more relentless pain. So a lot of times they will endure multiple medical treatments, and they may work or they may not work. But eventually, if that's all that you're doing, you're going to run into a limitation. The injections will stop working. The oral medications will stop working. And then you climb the ladder and you have to take more medications. So it's very important that patients, number one, know that they can get better. They do not have to accept some of the limitations that they've been told that they have to accept. There is a way to improve beyond those limitations. You have to find them, understand what the treatments are doing, and again, you may have to change the way you think about healing and treating your symptoms.
So when people are told that they need to be on meds forever, that's really not true?
Absolutely not true at all. We see patients now, that's not my scope of practice to put someone on or off of medication. So if a patient wants to get off medication, which most do, we refer them to the doctor who's prescribing the medication and make sure he's aware of what we're doing and can taper them off of their medication as needed. As they're getting more relief with our therapy, they're able to take themselves off of medication.
Now, again, please tell everybody before you go in about this, I'm sorry, what is
Feldenkrais.
Feldenkrais, and that she is the only licensed nurse practitioner. Can you please talk a little bit about that?
Her name,
because they only heard it once.
Her name is Jean Hills. She is the only licensed Feldenkrais physical therapist practitioner in Arizona. And her, like myself, we have a lot of medical doctors, from general practitioners to orthopedic surgeons to interventional pain management doctors, that refer us patients because they're not responding to the traditional application of physical therapy and chiropractic.
Well, we've got our lines open here, and I know everybody. I know myself. I have something that I'm always hit, some sciatic nerve that's been forever. Right? So many people can relate to that. Or a lot of people have they have bad shoulders. They have bad knees. A lot of people out there that have that. And our lines are open here, and there's so many people that are in pain. We've got them open so that you can get entered into win a comprehensive pain assessment and treatment, which goes along with that. It is a $225 value, free to you or anyone you know. Our number here, 602-277-5369, and toll free it's 1-866-536-1100. It's ArizonaPainAndPosture.com. What is the best way to avoid then, turning something into, pain into chronic pain?
That answer is the same for me as most heavy medical conditions, whether it's cancer or heart attack or chronic pain. You want to try to face your challenges before they become your challenges. A lot of people get a disease or they get a condition and then they change their diet and then they start exercising. So the idea here is to understand what your responsibilities are to yourself in order to live a healthy lifestyle.
Well, let me ask you something too, because one of the things that you said is that you said that you could teach them how to do things differently, and one of them is to sleep, right?
Yes.
How do you do that when we don't figure out how do we know what we're doing when our sleep? And how do you teach us to do that?
Well, you're talking about how the position and when you're sleeping at night, and also you're sleeping, so you tend to move and
right.
and you toss and you turn. It's preparing yourself right before you go to bed, and then it's using some of the simple things that most people know, putting a pillow between your knees, putting a pillow underneath your knees if you're lying face up. You want to make sure that the relationship between your head and your neck is supported. You don't want the pillow to be jacking your head forward so you're in forward flexion the whole time, and then you wake up and your neck is really stiff because you're in poor posture. We're always in pain
from sleeping. How many people wake up in pain from sleeping? I'll tell you, but you're all about educating, and that's when you said, we talked to originally, and you said, Carol, I'm all about educating everybody, and that includes how you do certain things, how you live your life. You are hands-on with this. This is not just him doing all of these modalities with you. It's you have to do it as well. We have our lines open here, and I'll let everyone keep on calling throughout the rest of the show. Our number here is 602-277-5369, and that everyone's getting entered in to win a free comprehensive pain assessment. It comes along with the treatment. It's a $225 value, free to you guys out there. They're rated with the Better Business Bureau. It's ArizonaPainandPosture.com.